Creating a better healthcare system that provides quality and patient safety is utmost to all medical professionals. Dr. Jack Cox of Hoag Memorial Hospital Presbyterian in Newport Beach tells us how they provide the best care for their patients.
When you think about quality and safety with regard to a hospital, you really want to think about what is the consistency of outcomes for those patients that come for specific problems, diseases, illnesses, or procedures. For the mass that come for, say, hip replacement, how many of those patients get complications from that surgery? How many of them go home in a timely manner? What is the pain control? What is the safety so that you're assured that there's no medication errors while you're in the hospital? When you're a hospital, a regional medical center like Hoag, obviously you look at your areas of excellence. That is, what are the types of procedures and illnesses that you see the most of? And then you want to look at specifically 3 different areas with regard to quality and safety. And that is, what are the specific outcomes for a given disease or condition? And these are national benchmarks and metrics that we're using. We also want to look at patient outcomes as far as safety. How many medication errors do you have? How many wrong site surgeries that you might have? We look at patient satisfaction. That is, in all of this, the patient plays a point in this is what we think quality should be, and this is how how satisfied we were with the outcomes. And of course, you also have to look at the financial indicators. That is, was the patient receiving the best value for the quality of care that they received? Historically, hospitals and physicians were paid regardless of what the outcomes to the patient were. That is, if I fixed your knee, I got paid whether you had a good outcome or a bad outcome. Now, insurance companies, the federal government, the Centers for Medicare and Medicaid Services are looking at reimbursing hospitals and physicians based on how good the outcomes are. Go into websites of nationally known organizations like the American Hospital Association, the American Diabetic Association, the American Cancer Society is another way of looking at that. There are a number of websites from governmental agencies like AHRQ, the Agency for Healthcare Research and Quality, that are available to individuals that would want to research that out. And lastly, of course, there are grading systems like healthgrades.com. While not perfect, at least would give you some opportunities of areas to ask questions about. Hoag, from a quality and safety standpoint, is doing extremely well. As a matter of fact, we were just named by Healthgrades in the top decile for 6 specific clinical areas. That is the top 5% of hospitals nationwide for things like joint surgery, GI types of procedures that we're doing. So Hoag is doing extremely well. However, I can tell you that Dr. Afable and the board and our medical staff are always looking at how can we be better. Our goal is to be in the Salucent Top 100 by 2010 and to be in the top 10% of hospitals nationwide for regional medical centers.